Hello, Dr. Jodi Berger Cardoso. Thank you so much for accepting to be a part of this highlight series. We're so honored that you accepted to be interviewed, and I'm very happy that our members will be hearing about your work and what you're, envision for the future of this work. So if that's okay, I would like to start with my question.
Yes, thank you so much for the invitation. I'm very honored to be able to talk about some of the work we've been doing.
Thank you. So my first question is, can you tell us about your current work and how it connects to the field of forced migration?
Yeah. So for the last 2 years, two of my colleagues, Jessica Borelli, who's a clinical psychologist at the University of California, Irvine, and then my former doctoral student, now assistant professor Arlene Bustad at the University of Colorado, Colorado Springs, and I have been working on the adaptation of an intervention called Confío en mí, Confío en ti, which is an intervention that works with mothers and children to improve attachment and relationship confidence so that they can have more resilience to addressing trauma. And so we've been adapting that intervention for mothers and children who have experienced migration-related trauma.
That is so great, and it's so inspiring as well for you and your colleagues to, address these needs that right now exist for so many people.
Yeah. We got involved in the work because we were collaborating with our community advisory board and our community work group, the Central American Minors Working Group. And one of the things that our members, who are experts in education, legal services, mental health, physical health, and other kinds of allied services, one of the things that they recognized was that families who experienced forced migration had a really difficult time in the adjustment period, particularly when things like family separation and reunification were also complicating their adaptation in the Houston community. And one of the things we noticed is that there were no interventions that helped repair the relationship that was disrupted by migration. So sometimes that looked like depression in the adolescents, behavioral problems, feelings of isolation and rejection in the family system. And as we try to help community members identify interventions that might help people repair that relationship distress, we realized that there were really no interventions that targeted relationship distress that comes up in the migration process. And that's happens when serial migration is a factor, when parents migrate first and youth or children migrate afterwards, or sometimes even vice versa, the children and youth come first and then the parents come later. But also just the migration journey itself has become so arduous and so dangerous and so long that there's really no space to process the kinds of trauma that come up in the journey. And there's no process to talk about the grief and the ambiguous loss that happens as a result of migration. And so we really started trying to think through how can we help families adapt to the Houston community by strengthening the relationships in the families, because we know that in the context of trauma, one of the resilience building factors is the strength of the parent-child relationship. So if we could strengthen that relationship, then we would have better outcomes in decreasing, depression, anxiety, post-traumatic stress disorder, and all of the other factors that influence youth after migration.
Yeah. Thank you so much for sharing this. And I can see, how you are addressing the issues that were highlighted by the community members themselves. And I assume and I can see that the work that you're doing will impact families and for their future children and so on and so forth. So thank you so much for sharing. My other question is what drives your passion for this work?
That's a really great question. I feel like I started this work really early in my life, when I was a Peace Corps volunteer in Ecuador. I was in a town called Santo Domingo de los Colorados, which is in the middle of the country. But also during the time that I was there was a lot of turmoil in Colombia. And so there was a lot of refugee crises with Colombians migrating to Ecuador. And then because of the economy and violence in Ecuador, there were a lot of people migrating to Europe and the United States. And I worked with a community organization that took children off the streets that were working and put them back into the classroom for primary school education. And one of the things that I realized was that there was a lot of economic disparity amongst individuals who did not have family members in living internationally, because they really benefited from the remittances. But one of the things that families were not talking about, and one of the things that families didn't anticipate as a consequence, is the long-term consequences of family separation. Parents living in Spain or the United States and children remaining in country of origin with other family members. And I realized that those children, while they didn't suffer as much financially, there was a lot of distress in the family system. There was a lot of feelings of worthlessness. There was a lot of feelings of loneliness, of abandonment, and no one was really talking about that complexity. And I was really interested in that, but I didn't really realize it at the time how critical that observation would be to my career. And it really wasn't until after I got a master's in social work and I was practicing clinical social work in the community, where I continued to get family after family after family where children were experiencing mental health symptoms like separation anxiety, depression, anxiety, behavioral symptoms, difficulty concentrating in school, when they were separated by deportation from one or both of their parents. And I started to see these structural violent responses to policy in children themselves. And when you see that time and time and time again, and you're asking critical questions in your clinical practice, like, why am I seeing these same problems in these same populations, in these same kinds of children, right? What are the similarities in these spaces, and why are we seeing these symptoms in communities that are largely very resilient? And so when I started to realize the policy piece and the governmental intervention piece, I really thought, like, I need to intervene not just on the individual level, but I need to start making contributions at a larger scale. And I don't know that I really wanted a PhD per se, but I did realize that in order to show up and sit at the table as a young female, I was going to have to show up with a skill set that others didn't require. And I know my colleagues of color have to even show up with greater skill sets. But it was sort of like, I want to be at the table. I want to be leading the conversation, and I need people to pay attention and take me serious. Like, what can help me get to that goal? And that was really when I decided to pursue a PhD. But it was really under this motivation to make greater change, not just at the individual level, but at the structural level and organizational level as well.
Thank you so much for sharing this. I think, like how you started and now you led so many important work, and you led the way for so many young scholars and students. So it's, I think, really inspiring to hear about your study, so your story, and how you drive your passion for this work. So my next question is kind of related with that. So considering your current research and literature on forced migration, what gaps do you believe require further exploration?
I think that our study, Confío en mí, confío en ti, is definitely filling a gap. I think that we know at this point that there are structural barriers, there are structural responses in policy that have negative consequences on the mental health of children and families. I don't think that anyone is arguing that family separation is a developmentally appropriate response to families that come to the United States. I think, though, we don't really know what to do once it happens. And how do we work with families and communities around issues like separation and migration trauma when there's a lot of shame involved with families who have had to make these very, very difficult decisions, life death decisions, to participate in serial migration or to engage in a migration journey that they know is dangerous, that could have dire consequences. It's really important to figure out how to join communities in honest conversations, but also respect the fact that these conversations are very hard and intrusive and create a lot of pain for people. And so I think sometimes we want to talk about the problem a lot. We know family separation is hard on families. We know that there are negative consequences. We know that U.S. policies, both before family separation and following family separation, negatively influence the mental health of children and families. But as these things are happening, as people are surviving these circumstances, how do we support them? And I think that remains a big question for me, which is like, these things are happening. We want them to stop. We're advocating that they stop. We're working at every level to influence policy so that we don't have these responses to humanitarian crises. But when they happen, what do we do? And I think sometimes there's this stagnation in the field on the what do we do part. And sometimes I think we respond to that by employing interventions and services and processes that have helped in other circumstances for other people. But I don't necessarily think that those are the interventions and processes and services that will work for everyone. And so, for example, in our work in the Houston community, in our work with Latinx immigrant families, and in our work with refugees from other communities, we know that people contextualize and experience the migration process very differently. And so, like, for example, for a long time, there's been cognitive behavioral therapeutic models to reduce post-traumatic stress symptoms and depression in kids. And I think that is a very valid modality, right? But that modality I've found doesn't really work well with the kind of populations that I'm working with, Latinx populations from countries in Latin America, where really the focus is relational and on the family and on the family well-being. It's not individualistic. It's not focused so much on the individual. And so as I've sort of seen these interventions not be as effective as they could, I've started to ask the question of how can we make the strengths of interventions more culturally adapted to the people and the current socio-political context that they face. And so for me, it's like, we know these problems are there. We know they have negative consequences. They are very important. We need to continue to identify their nuances, but we also need to be part of the solution, both at the policy level, but also at the intervention level. How do we have interventions that build from the community to the individuals that we want to influence, rather than a kind of top-heavy approach where we identify an intervention and we apply that intervention to that community and we hope that it works. So one area of growth, I think, is more research from a community participatory action research angle, where we're really building alliances and partnerships with community members, and not just those that are running agencies, but the individuals with lived experiences as well. Like on our community advisory board, we have people with lived experience. We have new migrants. We have established migrants. We have migrants that have experienced family separation. We have migrants that came and journeyed together. We have people who were separated and detained. We try and get an amplitude of perspectives, or a variety of perspectives, so that we really are building interventions and solutions from the ground up versus the top down. And I think that that's a tricky balance in academia, and one that we don't always, one that we could carry a little bit better, is building interventions from the bottom up versus the top down. And that doesn't include going to a community organization and being like, I have this intervention and I want to test it. That's not what I mean. It's like, we have this social problem. We have this thing that's happening. How are we going to fix it?
Yeah.
What would the fix look like? What does it include? What does it not include? It's really having a long-term partnership and conversation. And I think sometimes in the academy, that takes so much time to do that, you know, junior scholars in particular are really challenged with that angle of it, because they are on a tenure clock and they have to publish and they have to move quickly. And I have a lot of empathy for that, those kind of dual processes that are happening, but often are not aligned. Yeah. And so I think that it's hard sometimes for us to take that kind of approach, because it's so lengthy.
Thank you so much for that. I understand that, you know, like, just because you have an intervention that worked in a specific place with a specific community doesn't really mean that, you know, it will work for another community, and we have to ask those questions. That's what I understand. And you know, like, one of the last things that you mentioned was actually about the junior scholars, and that is actually my next question, which is, so what advice would you offer to students or early career scholars interested in this field?
Yeah, that's a great question. And at our mixer last night, I had the opportunity to talk to some early career scholars and kind of flesh out some of my thoughts and ideas about this. So I really appreciate you asking me this question and me being able to share some ideas that I have. I think the duality of being an academic and being committed to a community and being committed to community-based research is a difficult one. And the academy has its matrices or metrics about performance and productivity. And a lot of the community-based participatory action approaches really require you to align and join with the community. And as I just said, that building relationships takes time, just as healing from trauma takes time. There's no quick Band-Aid to heal from trauma, and there's no quick match, you know, with community and researcher. It really takes a lot of time building trust, building relationships. And a lot of times in these circles, we see a lot of turnover. So you're building partnerships with people that may not be there in a year. And so that's another piece of it. But I think for me, one of the things that I would advise early career scholars is to have kind of multiple projects in the process. So like, you might have projects with colleagues around the country that you can implement and publish with a little bit quicker. And then you have maybe secondary data resources or data sets that you can ask questions in, that you have a little bit more control over, that you can work on your productivity from that angle. And then you have these passion projects. And that is really the piece of academia that keeps me engaged and present in this profession. If I didn't have my passion projects, I don't know that I would have had the longevity that I've had in academia. I think truthfully, I would have probably found something else and kind of journeying into something different. But these passion projects that I find myself in really give me the energy and the drive to stay productive, to stay connected, to stay relevant, which is really hard to do long term in academia. Right? Because I'm doing something that I really believe in and that I really love. Like Confío en mí, confío en ti, we started in 2019 before COVID with $40,000 from an internal grant from the University of Houston. And we did this passion project, and we started with a completely different intervention. And we got all the way to the adaptation where we asked the question, is this feasible and acceptable to the community? And the community was like, this isn't feasible, and we don't like this intervention. And we were like, what? We have to start from the bottom up again. We missed something. Mm-hmm. What did we miss? We asked a research question. Mm-hmm. They answered it. It wasn't the answer that we wanted, but it is the answer. Mm-hmm. And so we started again, and that's where we found Confío en mí, confío en ti. But we did that all without grant funding. Mm. We just felt like the community was asking for this, that we could continue the conversation. We could guide the community to find a different response, to find a way to address this social problem that is so devastating to families. And we really care a lot about the families that we work with. So it never occurred to us to stop at the first iteration when we got the no. Yeah. It was just like, okay, well, now what are we going to do? And what's the next question we're going to ask? And well, that's not funded. That's okay, because this is my passion project. And I'm going to continue to be engaged in this passion project because I really, really believe that this is going to move the needle forward. This is going to respond to a need in our community that I deeply feel is relevant. And sometimes the relevant questions and the passion projects are not fundable. Yeah. And so I think that as long as I have one or two passion projects that I really love, and I can find ways to meet the criteria of the university for my productivity so that I can continue to be at the university and continue to be promoted and continue to be relevant and to present at conferences and meet with people and talk about my passion projects and talk about my other projects, then I feel like the balance of those two things feels really possible. Like I consistently tell my students that I'm robbing Peter to pay Paul. Like I'm doing the work that I need to do so that the university stays happy and compliant and relevant. And then I'm having these passion projects, which is such a gift to be a professor and to ask these questions and to have these passion projects and not worry about whether or not that passion project is funded or not, because I'm going to do it because I love it. And I feel like the mix of those two things keeps me really engaged in the university and really engaged in the work that I do and really engaged in the community. I think another thing is that earlier in my career, people tried to convince me to switch topics. They tried to tell me that immigration and forced migration and family separation, those weren't fundable topics. Those were topics that people had like social outrage about, right? But they weren't actually going to give me money to ask the questions that I was interested in. And sometimes they're right. Yeah. Sometimes at different stages of my career, it's been a bit easier to secure external funding to participate in these projects. And sometimes I've gone through dry spells where the funding is not available. And I've had to rely on community partnerships and community resources and internal research support to get me through these times when external funding is really hard to obtain in this area of research. And that is the problem when you study a project that, or an area, a content area that can be very polarizing. So I come back to always my sense of self and my internal locus of control, and also like my mission as a social worker. I identify first as a social worker and second as an academic. And so as long as I'm doing social work, as long as I'm doing advocacy, as long as I'm joining in healing circles with people who really see a similar vision of society as I do, where children are safe, where parents can parent their children in an environment where they're not worried for life or death or starvation. You know, if I am moving toward that goal, then if I can keep that as my center, then the noise around me about what's fundable or what's not fundable or what's this or what's that or what's popular, that dialogue kind of stays external to me. But if I chase the money, which I have done earlier in my career, you know, chase projects that were somehow a little bit aligned, but not really aligned with what I wanted to do, that work doesn't get funded. And I'm spending a lot of time working on things that I don't feel connected to. And funny enough, I find that comes out in my writing. That comes out in how I talk about it. And so it's like I have convinced myself that I should chase these streams of money, but I never seem to land that money because I don't communicate my love and my passion and my sincere connection and commitment to the work in the same way. And so I've stopped doing that. I only chase projects that I feel like align with the way I see myself as a social worker, my area of concentration and expertise, which is forced migration and mental health among immigrants and refugee children and families. And if it doesn't really align with that, and it's very siloed from that, then it has to be a very specific reason why I would participate in that project. I have to be bringing in a level of expertise that really aligns with my mission as a social worker for me to really engage in projects now. And that is a privilege that comes, I think, with tenure and then being a full professor.
Thank you so much for that. I think that is so inspiring for me as a PhD student, as a first year PhD student, and you know, like from that, I know that this will be inspiring for so many students and early scholars who are watching this video, because you're one of the scholars who you know, like lead that way. And for the people who have the same goal and who are experiencing some difficulties because they're working in this field, I think this will be really motivating and inspiring. Thank you so much for that.
Yeah. I just want to say, I think, you know, when I was a doctoral student and went on the job market looked really different. And there was a lot more mobility. And I want to own the privilege that space had at that time and how luck kind of came to play. Of course, hard work was involved in maximizing my doctoral training and networking. All those things were important, right? But there was an element of luck, being at the right place at the right time. And so I want to acknowledge that piece of it because I encounter a lot of really smart, really ambitious, really forward-thinking doctoral students that are entering a job market now that is much different than the job market that I entered. And so I don't want to suggest that it's apples to apples. I want to own the fact that, you know, these are different environments. But I will say that when I really stuck to doing the things and studying the things that I really loved and I really believed in and I felt really committed to, the solutions, they may have been different than I imagined, but they felt much more aligned with who I was than choosing a solution that really didn't make me happy. And the happier I am in my environment, doing the things that I want to do, and in my personal life, the better my work is.
Thank you. Thank you so much for that. I have one last question, which is there a book related to forced migration? It could be like a biography, novel, or a textbook that you would recommend.
Well, Arlene Bucheb mentioned in our presentation yesterday, Solito, and I think that's a great one. Enrique's Journey is another great one. Both of those journeys focus on unaccompanied minors and how young people travel or oftentimes migrate to the United States without a parent. Theoretically, I still really lean on Cecilia Falakov's work on the Mecca framework and looking at sort of the environmental context, the individual level context, the family context. I really appreciate how important her work is in helping us to understand the role of ambiguous loss and ambiguous grief and disenfranchised grief in the migration process. That's been really instrumental for me in helping me to understand how the process and journey of migration itself can really impact the family, even when there's no, psychological or physical or sexual trauma happening in the journey. So that really helped me contextualize how migration itself disrupts family networks and relationships. So those 3 readings, I think, have been really instrumental for me in kind of building my repertoire of work. And I truthfully lean very heavily still on the readings that I was trained in my master's program. I lean very heavily on theories of attachment and, mentalization and mindfulness, and sort of kind of thinking through then how can one act within their values and their authentic self. So I still read quite a bit of work, not directly around forced migration, but around sort of psychological health and well-being and mental well-being. And attachment work still really guides me in trying to understand how migration can disrupt some of these really core relationships, and then how that influences children and families across their life cycle. So those are still really the readings that I rely heavily on.
Thank you. Thank you so much for sharing, and thank you so much for having the time to meet with us and have this interview. I'm so happy for us and for all of the, FMI newsletter subscribers who will see this video.
Yeah, the work you guys are doing out of the Brown School is really innovative, and I really appreciate the effort to share the work of others and to collaborate and to bring people together to talk about this topic. We really are in a great position and to lean on one another through this time. And I really appreciate having colleagues and friends that I can count on, and they can count on me as we push forward and trying to improve the lives of immigrant and refugee children and families.
Thank you. Thank you so much. Thank you.